This conference will now be recorded.
Good afternoon, everybody. We're really glad you joined us. I'm Deanne Palin, president of Accelerate, which is a subsidiary of Roseco Group Holdings. We're really glad you joined us today, and we're looking forward to sharing some highlights about navigating COVID-19 in the workplace. There's a lot of changes that are unfolding as the time goes by here, and this team has worked very hard to stay on top of those changes. So as we're sharing information, just remember to navigate back to the CDC, the EEOC, and the Department of Labor for the most recent updates as we move through this COVID process here. We'll ask you to please use your chat capability on the webinar to ask questions, and our plan is to have several minutes towards the end to answer any of the questions that you all have. We're not attorneys, and we just want to make sure you know that. We are here to help you understand both from a safety and risk management standpoint, as well as a human resource and operations standpoint, just how to bring people back to the workplace, and more importantly, how to keep people safe in the workplace. Today, you'll have two presenters, Greg Saxe, who is the head of operations for our risk management subsidiary, RMA. He's a certified safety professional and has 30 years of experience in health and safety. He's been in construction industry as well as several other general industry. He's an expert at building proactive safety cultures and processes, and works very well with businesses to help set up positive cultures for safety in the workplace. Diane Tillman is our head of operations for our operations and HR subsidiary, Accelerate. She's a results-focused HR and operations expert with 20 years of strategic experience and leadership in workforce improvements. She's a Lean Six Sigma Black Belt, project and change management certified, and has worked in many different industries, including retail, manufacturing, sports, and entertainment. And just so you understand who Roseco Holdings Group is and the subsidiaries, we're an organization who is very focused on improving businesses and creating better lives. We work with our clients on creating financial health and profitability, better business processes and leadership, creating effective workforce productivity and safety, and better cultures. Roseco, the insurance advisors, provides both P&C and employee benefits, risk management advisors, OSHA and safety consulting and cybersecurity, and Accelerate HR and operations consulting. Here's the list of the topics we'll cover today. Overall, we're looking at setting up safe workspaces and protocols, staying compliant with regulations around COVID-19, and helping manage employees through a phased approach to return to work and stay safe in the workplace. Remember to please use the chat function to document questions as we go along. We'll be capturing those. We may not be able to address specific questions that'll require specific consultation, and we can handle some of those offline, but towards the end of the presentation, we'll take your questions and address those as a group. With that, I'll turn it over to Greg.
Good afternoon. So the coronavirus is called a novel virus, which means it's a new virus, which means nobody has immunity. And that's one of the biggest challenges that we have. The coronavirus is the virus. COVID-19 is the disease where the virus enters the body, typically through the lungs, and it starts to replicate. In the next 12 to 18 months, it's estimated that 160 million people will end up having the virus, and that's basically half of our population in the United States. So we will get through it, but the bad news is there's more viruses than stars, and I don't mean downtown Phoenix in the middle of the night stars, I mean in the middle of Wyoming number of stars. So there's a lot of other viruses out there. So our plan is to create a pandemic and infectious disease preparedness plan for not only COVID-19, but for the next one that is definitely going to happen somewhere down the road. So having a written program will allow us to have things in place where we can address what might be coming down the road while we're identifying and addressing issues that are occurring right now. In the formal plan, we should have a definite hazard assessment so that we look at our operations and we identify areas where we can protect employees, where we find deficiencies. And a side note, a lot of the GCs require having a written program anyways, so it creates a win-win scenario. We also recommend that you have a quarterback or somebody who can run that program for you. That person might pass the ball to somebody else, but they're definitely going to be the ones who are going to be running point on all of the policies and procedures, monitoring it, maintaining it, and keeping it current. And then, like with any program, define responsibilities. What are our leaders going to do in the program? Define responsibilities for the employees, and then train in those responsibilities and in the content of our program. It's important that we not just create the program, but we develop and create the training opportunities for our employees as well. Once we've got the written plan, then we need to start thinking about when we want to reopen the office, what do we need to do to make it as safe as possible and identify who we want to return into our office first. One thing I'd like to stress is I fully recommend that we make the return to work or to the workplace voluntary to begin with. And then have our supervisors evaluate who can return to work, who can re-enter that workplace. If priority would be given to somebody who maybe the working from home is not feasible, the old if it ain't broke, don't fix it. But if they can't work from home, they would definitely be a priority to get back into the office first. But other things that we would want to look at is, are our employees asymptomatic, which means they're not showing any symptoms of the virus? And do they exercise caution when not in the workplace? And this might require a conversation, because if people are not quarantining, or if they're getting into spaces where there's a lot of other people in that space, potentially that might not be a person that we want to bring back into our work area. This will be an honor system because we're not going to be able to monitor and regulate them when they're outside of the office, but it's definitely a conversation that we should have. And then finally, the last thing we should consider is our vulnerable population, people who have pre-existing conditions that this virus might be more challenging for. That's, again, a conversation we can't ask, but some employees might bring concerns to our attention, and we can just have a generic conversation related to some of those vulnerabilities and make them understand that if they fall into those categories, we want to look at that a little bit closer before bringing them back into the office. And then also establish a process for if we have employees who are at work and start to show signs or symptoms, or maybe we have visitors in our office that start to show signs or symptoms, have a process in place before we reopen the office so that we can deal with those individuals effectively. Once we've got that in place, next thing we want to consider is altering our workspace to make it as safe as possible to allow people to come back into the workplace. Create a flow of traffic. You might see this in some stores or some businesses where they have one entrance and one exit, and you basically have to walk through the entire structure to get in or out of a workspace. That will work, but we also want to consider, are we actually making people walk past people that they wouldn't normally walk past just because we have a traffic flow pattern in place? So it'll take us evaluating our workspace and kind of like in an emergency or in a fire, what is our closest path to get in and out of that workspace? So those are things that we should be considering when we're talking about reopening our office as well. Can we maintain that personal space, the 6 foot minimum? Can we maintain that social distancing for our employees? That if we have employees who are in cubicles and they're sitting back to back, that might not be an optimal situation to have somebody in that scenario. But maybe we can create barriers or walls and create that space or that distancing in the workspace to allow those things to happen. Another thing to consider is building changes. Do we have our air filtration system? Can we look at maybe putting in a HEPA filter, something to protect the workers from airborne contaminants? And then also no touch policies or no touch appliances, sinks, doors. One of the ways that this virus is transmitted is from people touching surfaces that have the virus on that surface. Now, the good news is that's probably one of our lowest potential for a transfer of the virus, but still something that we want to take serious. So we can establish policies of leaving doors open. Those are all things that we can look at to eliminate the frequent touching of surfaces by other employees. The other thing we can look at is limiting our population. How many employees are in the office at any time? Maintain that minimum density. And we can do that by altering shifts or days and not bringing everybody back into that workspace at the same time. And then establishing policies for our conference rooms and our restrooms and our break rooms. And one last thing that we recommend is creating an isolation space, a place in your workspace where if somebody does start to develop symptoms, we can get them away from the other employees in that space as quickly as possible. Now you might ask, why wouldn't I just send them home, which would be the preferred route? But if that day they happen to catch a ride or they stopped and dropped their car off for some service and they can't immediately exit the building, we want to plan ahead for that and create that isolation space. The COVID virus is a little bit challenging because it's very easy to spread and it's hard to detect. Some people, in fact, probably the majority of the people who will get this virus won't even know they have it, but they can still spread it. So some of the signs and symptoms, which can appear between 2 and 14 days after an exposure, are fever, cough, shortness of breath, chills, sore throat, muscle pain, headache, and a lost sense of taste or smell. These are all things that potentially could be there. A few of them could be there. None of them could be there. One of them could be there. So again, it's difficult to detect, but these are the things that we should be looking for and we should be training our employees to look for. Another thing you can do is put posters in your workplace to remind people of these symptoms, to remind them that we want them to constantly monitor their health to make sure that they're feeling good before they come into work, at the end of the day when they left work, and the next morning before they come back into the workplace. The next thing we should talk about is creating a process where we can screen employees or visitors. One option for visitors is we just don't allow them in the early phases of our office reopening. We just do not allow visitors into our workspace. But if we choose to allow them, what we should be doing is similar to our employees, setting a process in place where that we can screen them. And screening literally is just asking some yes or no questions knowing what some of the symptoms are. Do you have these symptoms? Do you have a fever? Do you have a new cough? Are you experiencing muscle aches or a sore throat? Those are all things that we can ask on the phone for a visitor before they show up. Those are things that we can ask our employees to self-monitor before they come into work every day. And again, this is the honor system. We're going to have to express to them, our employees especially, that these are things that we cannot do for you. These are things that we want you to do for yourself, and make sure that you're feeling 100% before you come back into the office. If we have somebody just show up at the door or walk into the lobby, we want to intercept that person as quickly as possible before they get too far into our workspace, and have a quick conversation with that employee as well. Some companies have gone to temperature checks. I can tell you they're not very reliable. It's tough to get the data that you want from a temperature check. The other thing is some companies have gone to having employees or visitors sign documents saying that they haven't had these symptoms, or they're documenting the temperature checks. And I just wanted to caution you that those become medical records that have to be maintained for 30 years. So if we do that, there's nothing wrong with doing it. Just understand that we can't just have that stuff and at the end of the week toss it in the trash, because it's something that becomes a document that we have to maintain on file for quite a while. Other thing we can talk about are behavioral changes, developing behavior changes in our employees, creating expectations for hand washing, the 20 seconds, the sing happy birthday while you're washing your hands, providing hand sanitizer. Those are things that we can help as supervisors to make sure that employees are practicing good hygiene while they're in the workplace. Banning or discouraging the shaking of hands. And ironically, this is probably one of the toughest ones to do because we've been doing it for so long. I've actually caught myself a couple of times. Somebody puts their hand out and I put my hand out to have that handshake, and then we both realize that's probably not the best thing to do. So some of these things are going to take a while to get used to, and some of these things might never go away. This might become permanent company policy for some organizations because of the future for potential viruses and exposure to those viruses. So what's our policy on that? How do we maintain that? How do we reinforce that? The next thing, how are we holding meetings? We might have to rethink how we're holding meetings and not have a bunch of people in a small space at the same time. There are a lot of online capabilities now that can help us with that. We can limit the population within that meeting room. That's one way we can control our exposure. And then what's our policy going to be for business travel? Can we eliminate, at least early on, unnecessary business travel? And at what point are we comfortable enough to allow employees to travel again? Those are all things that we should consider when we talk about behavioral changes. One that also we should discuss is just reinforcing the behavior for how what an employee does when they sneeze or when they cough. What are the protocols for that? A lot of times, nobody's been taught that you should cover your cough or turn your head when you sneeze or those types of things. So clearly defining what our expectation in that workspace is can help us create that behavior that we're looking for. And then once we get people back into the workspace, how do we keep that workspace clean? Well, first thing we can do is maintain an adequate stock of cleaning products like disinfectants and hand sanitizers, and have that stuff staged throughout the workplace. We all know people will do what's easy, and if they have to go around and look for the disinfectants or the hand wipes or the sanitizers, they're probably not going to be using that as often. So make sure that we have enough of that material in the workplace so that we can reduce that risk for transmission. And then educate. If somebody's going to use the copier, have them sanitize their hands first before they start touching the copier. Train our employees to stay within their own workspace so they're not walking around to different cubicles, different offices, different parts of the building. If they have to make a phone call instead of walking over and sitting on somebody's desk and having a conversation, those are all ways that we can reduce the amount of cleaning and reduce the potential exposure as well. Masks and face coverings, there's been a lot of talk about that lately. The virus is a couple thousand times smaller than a grain of sand. So we're talking about very, very tiny particles. And most of the medical masks that we see most people wearing, whether it's the medical masks, the bandanas, the gaiters, they really are doing nothing to protect the employee from the virus, but what they're doing is to protect the public from the employee potentially shedding that virus. So that's a conversation that we need to have with our employees, especially if we're providing the mask, so that they can understand that, hey, this is not a scenario where this is protecting you, this is protecting others while you're wearing it. There is also a potential for eye exposure. So any route of entry this virus can take to get into the body, there's been a lot of talk about respiration, and obviously that's the #1 route of entry because we breathe constantly. But if we're in an area where there's a lot of airborne aerosolized virus in that space, there's a potential for eye exposure as well. So we'll talk about that a little bit here going forward when we talk about specific exposures for our employees, but just something to keep in mind. Outdoors, the good news is they did a study in China, and of the 7,000 people they studied, they could only relate back to a potential exposure in the outdoors to one of those individuals. So if we're working outdoors, there's a very limited potential for exposure to the virus, which is something that is definitely great to hear for most of the contractors who are on this call. More on masks and face coverings. Create specific policies. When do we want them to wear the masks? Where do they get them from? How do we clean them? That all needs to be communicated and trained. One of our biggest exposures, especially on the construction side, is getting to work. We've got people who either show up at the yard in different cars and then hop in the same truck and share that space to the job site. We've got employees who might carpool to work and then hop out of those vehicles and get in the vehicles with other employees. So now not only are we increasing the potential for the spread of the virus, but we're increasing the potential for the spread of sick employees as well. So those are things that we need to consider. One of our highest priorities on the construction side for sure. What if we're entering other people's property? Maybe we have salespeople or staff who have to go into other people's workplaces or homes. What's our policy for wearing a mask in that scenario? I can tell you from my personal view, if we're going into other people's homes, our employees should definitely be wearing a mask, because if there is an exposure in that home, obviously we're going to have a hard time proving that it didn't come from our employees. So those are things we have to consider as well. We talked about the limitations of the medical masks. If we are lucky enough to have the N95 masks, which are designed to protect against the small particulates, understand that comes with its own requirements as well, as far as having a respirator program, fit testing, health evaluation. All those things are required before we let employees wear the N95s as well. So train our employees. What masks should they wear? When they should wear it? How do they clean the masks? Heat is our friend. If we have a mask or a device that we can reuse, we can throw it in the dryer. We can leave it in a nice warm vehicle, sitting in the sun. Heat's going to kill that virus pretty effectively. One thing I don't recommend is throwing anything like the medical mask into a microwave, because there are small pieces of metal in there that can cause a fire. But make sure we've trained our employees on the limitations, the use, the maintenance. And then once we have that program in place, the next thing we want to do is define when we have an employee who has a potential exposure, what should we do next? And I'm going to turn it over to Diane at this point and let her take over from here.
Thank you. Like Greg mentioned, unfortunately, the coronavirus is not going to go away. So the likelihood that you could have an employee test positive is becoming more of a reality. And in recent developments, there is some potential that you could get this virus more than once. So you'll want to make sure that you're prepared on how to best respond to an employee who tests positive. So you'll want to have a plan in place on how to handle certain topics, and we'll discuss each of these in greater detail. But who should be the person that in your company that should respond directly to the employee? You'll want to determine if you need to isolate the employee. How do you handle notifying other employees, customers, clients, or guests? Do you need to clean and disinfect their workspace or potentially shut down your facility? So first, we're going to discuss about who should talk to the employee. If you have an HR resource, this is where you'll want to partner with them to help you navigate through all this. If not, it might be a good idea to identify someone in management that will be handling these delicate conversations. You'll want to make sure this person, first and foremost, is that they're showing care and concern. This will be a scary time for the employee, and you'll want to assure them that you're going to help navigate through this illness with them. It's important to remain calm and empathetic. In these uncertain times, it can be easy to overreact. Reassure the employee that their identity will remain confidential. You'll want to limit who in your organization is informed of the identity. According to the EEOC, which individuals in your organization need to know the identity of the employee will depend on each workplace and why a specific person would need that information. Keep in mind that any information about an employee's medical symptoms or any testing must be kept confidential under the Americans with Disability Act. Let them know you'll help them coordinate taking a leave or paid time off if they're eligible until they're fit to come back to work. And we'll talk about the new paid sick time law and the expanded FMLA a little later. HR or yourself will need to ask the employee some potentially difficult questions. You'll want to find out who they have been in contact with for the last 14 days. Have them try to remember who all they have worked around. Did they come in contact with customers, vendors? You'll have to put together a communication plan on who you need to notify, and let them know that they've possibly been exposed. Again, please don't disclose the person's identity. Now, it might be easy for other employees to figure that out, but that's not going to be on you. According to the CDC, if a person has COVID-19 or they're experiencing related symptoms, they should go into isolation immediately. So now you got to find out, well, when is it safe for them to return back to work? You could have a situation where your employee was not tested, but told to self-isolate by their doctor. Employees may return to work when all three of the following conditions are met. They've had at least 3 days after resolution of a fever, and they have not taken any fever reducing medications. And they have improvement in respiratory symptoms, so cough and shortness of breath have been improved. And at least 10 days have passed since the symptoms started. The CDC just recently changed this from 7 to 10 days now, as they're determining a person can shed the virus longer. Now that testing is readily available and it's much easier for employees to get tested, you may have employees that are tested and they have a little bit of different criteria to come back to work. Again, all three of these conditions need to be met. No current fever without assistance from Tylenol or Advil, improved respiratory symptoms, and if they have received 2 tests that have come back negative, and the tests have to be taken more than 24 hours apart. So how do you handle notifying other employees, customers, or vendors? Once you've identified the other employees, customers, guests, or vendors that your positive employee came in direct contact with, you'll need to notify them directly. You'll need to decide who should self-isolate, and it's always best to overly be cautious. And if you can have them work remote while they're self-isolating, that's the best scenario. You'll want to put together a communication piece that will inform the rest of the company that there was an employee who tested positive. Again, it's important you do not reveal their identity. Decide what steps the company will take. Will you allow your employees to work from home again? You may have to close the office for a short period of time. Be sure that all this information is included in the communication. Be transparent and honest. Now we're going to walk through some different scenarios for responding to an employee that has notified you of a potential exposure. So employees who are household contacts of a confirmed COVID-19 case and do not become ill must stay home and self-isolate for 7 days after the isolation has been discontinued for that ill household member. So technically that could be up to 21 days. Employees who've had close contact with a confirmed case in a non-household setting must stay home and self-isolate for 14 days after their last contact with the case, even if they don't develop symptoms. Now, close contact is defined by the CDC with being approximately 6 feet in contact with a positive case for a prolonged period of time, which is defined as 10 minutes or longer, or if they had direct contact with the infectious secretions. So basically, if they were coughed directly on. Employees who were in the same indoor environment with a COVID-19 case but not meeting criteria for close contact, meaning that they were farther than 6 feet away, should self-monitor for symptoms for 14 days after their last contact with the case, and they need to isolate if symptoms develop. Testing is becoming more and more readily available, so you might find your employees are taking the test just because they can. So you may have a scenario where you have an employee that will show no signs or symptoms, but they did receive a positive test. In that case, they can stop self-isolation when at least 10 days have passed since their first positive test and have had no signs of illness. Again, I encourage you all to refer to the CDC for the most up-to-date isolation information, as it has changed and will continue to do so. So now we're going to talk about, under the Families First Coronavirus Response Act, 2 new policies were issued: Paid Sick Leave and Expanded Family and Medical Leave Act. These apply to certain public employers and to private employers with fewer than 500 employees. The Department of Labor has issued a required poster regarding this act that must be displayed in a prominent location. So you can post this alongside your other required employment posters on the job site. Under the emergency paid sick leave, keep in mind this is at the federal level. Covered employers must provide paid sick time when an employee is unable to work or telework due to COVID-19. This went into effect starting April 1st, and it's going through, as of now, to December 31st, 2020. This is in addition to an employer's other leave policies, such as Arizona paid sick leave. Reasons for paid sick leave. The employee has been ordered or medically advised to self-quarantine or is isolated or caring for a person who has or experiencing symptoms, or caring for their own child under age 18 if school or child care is unavailable. The duration of the paid sick leave will be different for full-time versus part-time employees. Full-time employees are eligible for 80 hours, 2 weeks of paid time off, and part-time employees, you would look at an average number of hours over a 2-week period, and that would be the allotment they're eligible for. Sick time does not carry over from 1 year to another. And again, this sick leave is supposed to sunset at the end of the year. The rate of pay will depend on the reason the employee is taking paid sick leave. The employee is due full pay if the leave is because he or she is subject to federal, state, or local quarantine or isolation order related to COVID. If they've been advised by a healthcare provider to self-quarantine, or they're experiencing symptoms and is seeking a medical diagnosis. That total pay for these reasons is capped at $511 per day, or $5,110 in total. The employee is due 2/3 pay if the employee is taking leave because he or she is caring for an individual subject to federal, state, or local quarantine or isolation order, or is experiencing any other substantially similar condition that's specified by the U.S. Department of Health and Human Services. And that really hasn't been defined yet. So whatever really that means. The total pay for these reasons is capped at $200 a day or $2,000 in total. The other leave is the expanded FMLA. Any employee who has worked for your company for at least 30 calendar days is eligible to take up to 12 weeks of partially paid FMLA leave if they're unable to work or telework due to a need to care for his or her child whose school or place of care is closed or child care provider is unavailable for reasons related to COVID. Now that businesses are opening up in Arizona, it doesn't mean that childcare is available. So you may have people that might need to leverage this leave now that schools are closed and businesses are opening back up. A child care provider is someone who cares for a child. So this could be any individual who's paid to provide child care and individuals who provide child care at no cost or with or without a license on a regular basis. So place of care is a physical location in which care is provided for a child. So this could include daycare facilities, preschools, before or after school care programs, summer camps, summer enrichment programs, and such. The first 10 days of extended FMLA are unpaid. Then the employee is entitled to receive 2/3 pay for the remaining 50 days, again with a cap of $200 per day or $10,000 in aggregate. The employee at their discretion may opt to use PTO, vacation, company provided sick pay, or the emergency sick pay to receive the pay for those first 10 days. One thing to note is that in some instances, it may be difficult to obtain the usual FMLA medical certification or documentation of illness during this pandemic due to the high demands on the doctors and the healthcare facilities. Also, keep in mind, there may be other state and local laws where employees may be entitled to other employer-provided benefits or other leaves. Another thing to keep in mind, actually there was, according to a poll taken by a leading mental health care provider, Ginger, nearly 50% of workers have negative mental health effects directly due to this coronavirus. 88% of the US workers are stressed. 2/3 of those workers stated this is the most stressful time in their career. So mental health and stress are a common thing that's occurring, and stress can be directly related to morale and employee engagement. You'll want to be sure to partner with your benefits provider to provide information on EAP or any other resources for mental health concerns, stress, and how to cope. Prepare for concerns, provide resources, and communication is key. Every employee's situation may be different. You might have some that are high risk, you might have some that have childcare concerns. It's just really important that you take time to train your managers on how to best respond. There's a lot of great resources out here. The CDC has great information. Be sure to guide your employees to the CDC. You know, they have, as you can see on the screen, they have great tools and pamphlets about how to prevent getting sick. If you're sick or caring for someone, what you need to do. There's also other great resources that you can find on this presentation, and I do believe we will have this presentation on our website for you to refer to. You can actually click right onto these documents, and it's going to take you directly. The link will take you directly to the page. So again, OSHA, the CDC, World Health Organization, they all have great resources. I know Greg mentioned different supplies that you might need. I talked about the DOL poster. Again, you can download this presentation, click on these links. It's going to take you right to the information.
And just to wrap up here, wanted to remind you, if you didn't know already, we've got a wonderful website link with a lot of the resources that we've referenced today, as well as templates, posters, and our presentation, which will be recorded, will also be available on www.rosecoinform.com. Please reference that and feel free to share wildly with others. We're ready to turn to questions here, and I want to pose a few that have come in. So the first one is for Diane. Can an employer administer a test before allowing employees to enter the workplace?
Great question. Yes, the employer can choose to administer testing before entering workplace to determine if they have the virus. The EEOC has stated that if there is a direct threat to your business, then you can test. They do state to use a reliable test. And also, I just want to note, just because they're negative today does not mean they'll be tomorrow. It might be a good idea that if you have someone with medical training or a manager who's trained to administer and administer the testing. But again, yes, you can.
Great. Next question. What do I do if an employee refuses to return to work upon the opening of our business?
Yeah, we've had a few people already be faced with this. Unfortunately, I think some employees are probably making more money sitting at home collecting unemployment. In that case, you can let them know that if the offer to return to work has been reported, or you have offered that employee to return to work, you have to report to the state government that you offered them the job and that they will stop receiving those benefits. But again, you got a lot of different scenarios that could come up. You may have somebody who has a disability under the ADA. You could have an employee that may be entitled to a different type of leave. Each scenario brings a different challenge, so I highly recommend you seek legal counsel when they're refusing to come to work. I mean, more importantly, you want to find out why aren't they wanting to come back, and then definitely seek legal counsel for that.
Great advice, Diane. The next question is for Greg. We know that other countries are having border close, and even within the United States, there's shelter in place variances between city to city, county, or state. What if I have an employee that goes to one of these locations and is exposed? Can I require that they quarantine upon return?
I'd refer back to the HR guidelines on that as well. If it's your policy that they self-quarantine, definitely would want to have them do that. If for whatever reason they come back and they don't show signs or symptoms, but you're still concerned, you can definitely have a conversation with them. If they have an opportunity to work remote, that would be your first preference. But yeah, definitely review what your policy is, because they should be treated like any other employee if they're not showing symptoms.
Great. So with that, we're going to turn your mics back on and open it up for questions from the group. We have a few more minutes and want to make sure we're allowing questions to come in here.
Just remember, you might be muted, so if you have a question, make sure you're not muted before you try to ask.
Okay. We're open for questions. If you could just say what kind of business you're in and your name, that'd be great.
Hi there, this is Tamara Rambis from International School. Question is workers' compensation. Just wondering how employee that potentially acquires COVID can make a claim against our workers' comp policy. Any guidance, advice, thoughts you have on that?
So it could, if there's a potential that it occurred in the workplace, so that's what's going to have to trigger the claim. If it's somebody where there's not a direct relation between their work and exposure, I mean, a good example would be somebody in the healthcare industry. There's a pretty reasonable expectation that if they pick up the virus, it could have potentially have happened at work. If they're a roofer or somebody who isn't normally in a scenario where they're exposed to people with the virus, then it'd be a little bit more of a challenge to determine if it had occurred at work or not. So definitely the potential is there. Some states are treating it a little bit different than others, but yeah, definitely that's why have that policy in place, have our procedures in place ahead of time, try to prevent that exposure from occurring. And then after that, it's going to be up to the, basically the investigation to determine if they can establish a work relationship.
Understand. Thank you.
Okay, any other questions out there?
Looks like they're dropping off.
Just to wrap up, please remember this RosecoInform.com as a reference and library for lots of tools and templates. Feel free to share that wildly with your colleagues and friends who are business owners. And lastly, wanted to share Diane and Greg's contacts. They are on this presentation as well, and you'll see those when you pull them up on RosecoInform.com, both emails and phone numbers. Thank you so much for joining us today, and wish you the best of luck as you open up your businesses for workforce to come back in and as you navigate through this process. Thanks for joining us.